We're going to be talking about and showing you the 6 Echo Responder Medical Kit. We designed this kit with first responders in mind. This kit was based around the needs for firefighters, EMTs, emergency medical responders, and all these first responders that need medical gear. But it's also a great kit for civilians to keep in their vehicle that gives them much more expanded capabilities than simply a small first aid kit. In this video, we're going to give you a breakdown of the Responder Medical Kit. But on our YouTube channel, we have not only product information, but we also have a lot of training videos that teach people how to use a lot of these medical supplies, how to do proper assessments, how to treat injuries. So check us out on our YouTube channel. And if you found this video helpful, leave us a like. We'd really appreciate it. Leave us a comment below if you have any questions regarding this video or any other videos, or if there's something you would like to see in the future. And subscribe to our channel so you get updated of any future videos that we post. So the Responder Medical Kit is based out of a Maxpedition sling style bag. This bag only has one single strap, so you can carry it on one shoulder, you can carry it crossbody, and we found that this lightweight bag with this sling style is the best method for being able to walk through the woods without getting the bag caught in briars or entangled in things. We can easily throw it on top of turnout gear or extrication gear when we're trying to make access to a patient in a vehicle. And the bag itself is small enough to where you can stick it under the seat of a vehicle, throw it in the trunk of your car, and it's one of our favorite form factors for being able to carry medical supplies with you when you go places. So the Responder is packed in this Maxpedition Edge Peak bag. This is the sling style, so we have a single sling on the back. This is mounted in the very middle, so you can use it either right or left side. So this connects to the bottom. You've got two D-rings along the bottom, so if you want to swap from one side to the other, just unclip this, clip it onto the opposite side, and then you can swap back and forth. So I'm going to leave it on this side. So sling bag goes on. And then they have a secondary strap that will help secure it a little bit better. Clips into here, it swivels. So again, left to right side, it doesn't matter. It'll clip in and swivel, and then that helps secure it across your body. But this is optional. So if you want, you can take this off, you can unclip it and just take that out of the way if you just want it to be a single sling. So this bag is made of very durable materials. It's very lightweight, but it's got really strong, thick material that it's made out of. It's got MOLLE attachments on the front and the side for additional accessories that you may want to carry. It's got large zipper pulls. These zipper pulls are easy to gain access in the kit even when you have gloves on. So that's nice. It's got a carry handle up on top. It's got the sling on the back, extra padding to make it more comfortable for you to wear. As we open up the back of this kit here, there's a lot of extra room for us to be able to add extra things to our kit. A lot of volunteer firefighters will stick their department shirt in here so that they have something they can throw on when they go on a call. Some people will add IV supplies or advanced medical things to this kit, but there's a lot of open space in the back for you to add an extra bag or some extra gear or something to it. We specifically left this spot open because everyone's mission-specific needs will change based on what they're doing, what environment they work in, what their licensure level is. So there's a lot of extra room here for you to add extra things you need to the kit. In this top pocket right here, we'll open it up. We've got 4 sets of gloves. We have some other kits where we have these gloves actually in a rolled format, but we found that the rolled format, after they stay in your kit for a long time, they end up starting sticking together, and it becomes harder for you to actually quickly deploy these, open it up, and be able to get your hand in them. So by loosely stuffing them in here, it actually works better for you to be able to pull these out quickly and get them on your hands. So we have 4 pairs of gloves in this top pocket. Another thing that's in this rear compartment is our airway management supplies. So we have a BVM right here. So this BVM is our bag valve mask, or our ambu bag, and that is what we use to give ventilations to patients that are in need of rescue breathing or are unresponsive. Along with that, we have some airway adjuncts. So we have a OPA kit. These oral pharyngeal airways are in this little plastic box. We have several different sizes in here depending on the size of your patient. And then we also have NPAs in this pocket in the back. These NPAs, or these nasopharyngeal airways, we have 3 different sizes, which should cover the majority of your large child to adult patients. Each one of these NPAs also has a small packet of lubrication that is hot glued to it, so that you have that with it. So all you need is to size up the correct NPA. You've got a packet of lube already with it, open it up, and you can insert that into the patient. The last section we have here in the rear compartment has a SAM splint and then also a couple triangle bandages. The triangle bandages can be used to hold the splint in place. It can also be used for a sling and a swathe. You can also use them for head bandaging, which we've done a video on, so you can check out our YouTube channel there and check out our head bandaging video. And there's a lot of other applications you can use these triangle bandages for. Then we have the SAM splint, and we've also done some training videos on that. But this is a very universal, multi-purpose splint that you can use in a variety of different applications. This compartment in the front is where we keep our diagnostic supplies. So if you open this up, there is a zippered pouch that we'll take out. We open this up and there's a stethoscope and a blood pressure cuff in this pouch. Now, this stethoscope is a very cheap, basic stethoscope. It's absolutely fine for taking blood pressures. You can use it for listening to lung sounds, although it's not going to be as great a quality as one that you would pay a lot more money for. But we also found that most people like to purchase their own stethoscope, get their initials engraved in it, and do a bunch of fancy things, have fancy colors. So we didn't want to dedicate a lot of resources into putting a high dollar stethoscope in this kit. So this is a basic stethoscope. This is also a great one to use on a nasty trauma call or a CPR with, there may be some blood or vomit or something, and you can use it and you can literally throw it away. It's cheap enough to where you can throw it away. You can buy another one from us. You can find these pretty easily. So this is not a high quality stethoscope, but it's something to get you started, and it's something that you can use as a disposable one if needed. Also in this pouch is our blood pressure cuff. So the blood pressure cuff is the adult size, and this is what we would use to check a blood pressure on an adult. We also have a pin light in this pocket too for checking pupil size and reaction. And so that is all in this top compartment with our diagnostic kit. Okay, the last compartment here. On the very front and the bottom of the bag, we have the majority of our trauma supplies and some other miscellaneous supplies. So let's open this up and take a look. Inside here, we have several different types of gauze. We've got 4x4 gauze, we have some rolled gauze, we have some ABD pads or combine pads. So there's a lot of different types of gauze based on what type of injury you're dealing with. We also have a twin pack of chest seals here in the back. We also have one of our mini modules. These mini modules have Advil, Tylenol, Benadryl, Band-Aids, antibiotic ointment, steri strips, alcohol prep pads, sting relief pads, all that in this little Ziploc bag. We have trauma shears. We have a roll of Coban or self-adhesive bandage, so you can wrap this around gauze to hold it in place and it sticks to itself. We also have a roll of tape and an emergency blanket in this front compartment. So when we designed this kit, we wanted to lay out everything to where it was easy to get to. You didn't have to remove some things to get to other things in the back. And we wanted to lay it out in sections. So we had Airway in one area, Splinting in another, diagnostics in one, and then all our trauma stuff in that front pouch. We also wanted to leave room for other people to add specifics they need to the kit. So they can add extra blankets, t-shirts, webbing, whatever they need to that kit and still have room. So the Maxpedition Edge Peak bag was the perfect bag to fit that roll that we needed, and worked out great for our responder medical kit. We've sold these to firefighters, EMTs, first responders, search and rescue teams. We've shipped these all over for different responding agencies. And we also have a lot of civilians that are keeping these in their vehicles as a trauma bag and as a medical bag that just stays in their vehicle with them, so they have some basic diagnostic airway equipment on top of the trauma supplies. So this is kind of the all-around, well-rounded bag that gives you a little more capabilities, such as a BVM and splinting, that the Minuteman may not, or that some other first aid kits that you have in your vehicle may not. So this is just one step above. So you can find our responder medical kit along with our other kits and supplies on our website at 6echosystems.com. And if you have any questions or comments about this kit or any of our other kits or training videos we've done, we'd love to hear from you. So leave us a comment below or head over to the website and use our contact form to contact us. We love to hear from people, and we oftentimes use that feedback to either change what we're doing or add new content to the website or the YouTube channel based on what we get back from the people that follow us. So we really appreciate hearing from you. As always, stay vigilant and stay safe.